How soon after a head injury can schizophrenia develop? Have you ever wondered how a head injury might relate to schizophrenia? This connection is often misunderstood, so let's clarify the facts. Schizophrenia is a complex mental disorder influenced by both genetic and environmental factors. While head injury has been studied as a potential environmental factor, it is not a sole cause of schizophrenia. Research shows that mild head injuries, especially those occurring during childhood or adolescence, can precede the onset of schizophrenia by a significant amount of time. On average, it takes about 12 years for psychotic symptoms related to schizophrenia to appear after a childhood head injury. However, this period can vary widely, ranging from as short as 1 year to as long as 25 years. This indicates that schizophrenia does not typically develop right after a head injury but may emerge many years later, often during late adolescence or early adulthood. The severity of the head injury plays a role too. Most studies focus on mild injuries, like concussions. Interestingly, greater severity within this mild range often correlates with an earlier onset of psychosis. For instance, individuals who experienced a childhood head injury tended to show symptoms of schizophrenia about 5 years earlier than those who did not have such injuries. It is essential to note that these findings are primarily observed in people with a strong genetic predisposition to schizophrenia. This means that head injury alone is unlikely to be the only cause. Instead, it may act as a contributing factor that interacts with genetic vulnerability. When we look at cases of psychosis following traumatic brain injury more broadly, the onset of symptoms can vary significantly. Some individuals may develop psychosis within the first year after their injury, while others may experience a delayed onset, even several years later. Research indicates that around 40% of post-traumatic brain injury psychosis cases appear within the first year. This number can increase to about 70% by 5 years post-injury. The course of psychosis after a head injury can often be gradual and chronic. In summary, schizophrenia related to head injury typically does not develop immediately. It can appear many years later, often around a decade after the injury, particularly in those with genetic risk factors. The head injury may accelerate the onset or expression of schizophrenia rather than directly cause it on its own. Understanding this helps clarify that while head injury is a factor to consider, it is part of a broader interplay of genetics and environment in the development of schizophrenia.